Tom, when it comes to question time, this first. We'll tell them beforehand if you want to ask a question.
Good afternoon, Your Excellencies, colleagues, friends, students, and of course, especially our three candidates, Dr. Tedros, David Nabarro, and Sanya Nishta, who have kindly agreed to debate and discuss with us here at the Graduate Institute. I'm Ilona Kickbusch. I'm the director of the Global Health Program, Global Health Center at this institute. And I would also like to welcome the partners for this event, the Rockefeller Foundation, Chatham House, and the UN Foundation. And it's been a great partnership putting this together. Looking at the Twitter messages preceding this event, one of those messages stated that this was a historic event. And indeed, for the very first time, candidates for one of the most important positions in the UN system are discussing their vision of global health diplomacy and political leadership with such a large worldwide audience. Not only are all of you here in this room, but we are webcasting this worldwide, and the webcast, in order to allow more people to participate, is translated into Spanish and French. Bonjour et buenos dias. This is, I believe, how it should be in the 21st century, and we should all congratulate WHO for having opened up the process in this way, and gratitude to the candidates for being available. In preparation, as some of you know, we have conducted an open call for questions on Twitter. We have received questions from individuals and from organizations, from the co-organizers, from the Geneva Health Hub, and of course we had our own priority list of 10 questions that is available to you. We have grouped these questions and made them available to our moderators, Zia Saminasi, advisor to the Indonesian Minister of Health, and Andrew Jack from the Financial Times. The moderators, after a briefing session with us, have agreed on a final list of questions. They will post them to the candidates in an equitable manner and also encourage debate. So we hope this will also be lively and interesting for you, because it is just a different nature of how we're approaching this. There will be no questions from the floor, but you can rest assured that many of the questions that you've put to us on Twitter are being posed by the moderators. We're an Institute of International Relations and Development, and therefore our interest in these discussions was focused on political leadership and diplomacy. Most simply put, how will the candidates approach issues of power, competing interests of stakeholders, processes of consensus building, representation, and the like? We define political leadership as affecting change to support good policy. If that's the way we look at it, then questions arise on the value base of policies, the political power available to act, and the source of authority for those who act. And there are important debates aiming to get a clearer understanding of the interaction between the personal leadership qualities of individuals and the institutional and the political factors around them. Many analysts say that the political power and authority inherent in the position of the Director General of WHO has only rarely fully been put to use, and we will explore what's possible with the candidates. Our moderators will lead us through this debate and get all of us to understand the candidates and their goals better. So I hope this will be an interesting new step, not only in relation to WHO, but to many global health organizations. They are so important that their leaders and the process of selecting those leaders must be open and more transparent than we have done in the past. And therefore, this process that the WHO has created is, I'm sure, one of those processes that will be discussed throughout the UN system and throughout global health leadership. So from my side, again, a very warm welcome, and I would like to hand over to David Heymann to say a few words on behalf of Chatham House, our partner here in this venture. Please, David.
Thanks very much, Ilona, and thanks to the three candidates, and also to our two moderators and to you for having come to this session. I think everyone here understands the importance of the World Health Organization in the world and how we must make sure that it succeeds during the coming years. Ilona asked me to say a little bit about how the Director General might best use the political power that's vested within that position. And in thinking over how the Director General might use that and what might be the challenges, the first thing that came to mind was how to deal with countries that are hesitant to collaborate or to report or to work with the international community. Is this something that the Director General will do out in front in public or behind the scenes trying to use powers of persuasion? At the same time, how to ensure that all who can contribute can sit around the table of WHO and contribute. As you know, there are difficulties with the private sector and some NGO groups sitting around that table, yet this is vital in today's world to make sure that every potential partner contributes in some way to global health. How does the new Director General ensure that this occurs? How to focus the organization is another problem, especially when resolutions continue to come each year from member countries, and there's a limitation of resources and a need to focus on what WHO does best and leave to others what they do best. Leave to the collaborating centers, leave to other partners to really do the work that maybe WHO can't do because of its resources or can't do because of its focus. How best, finally, to bring WHO along with a vision. We'll hear each of these visions today from the three candidates, and again, we're very pleased that you've been willing to come with us and from our moderators. But it will be very interesting to see how they can bring along the member states with their vision, because that's what's really important, the vision in front and a Director General that meets that vision by bringing member countries along, not by waiting for them to tell what to do. So thank you very much for having come, all of you, and to our candidates and moderators. Thanks, Ilona, for the privilege.
Thanks very much, everybody. Thank you, David and Ilona, and thank you above all to our three candidates. Thank you to everyone here for attending, and also to the many, many people, the hundreds of Twitter questions and points that have been raised in the last few weeks, and many other people who are following this live stream. A very important moment in a very important organisation. We've got about an hour and a half. We want to make this as informal as possible between the three candidates and Dia and myself. Unfortunately, we do have to try and be as constrained as we can on time. So as David said, we won't be able to unfortunately take questions from the floor, but we're certainly trying in our answers that the candidates have all read also. I think all of your comments and questions and those of many others. So we'll try to touch on as many of those issues as we can over the next hour and a half. Because of constraints of time, we actually have the famous WHO traffic light at the top, and that will switch to red after 2 or 3 minutes. So we're really pleased trying to get all of our candidates here to limit themselves to that time limit so we can get through as many of these questions as possible. But let me begin by asking each of you in turn to just lay out for 3 minutes your political leadership vision for the WHO. Turn first of all to Sam.
Well, good afternoon, everyone, and thank you so much for having us here. I'd like to make 4 quick points. But firstly, I think we have to appreciate that the global political landscape for health has changed, and so has our understanding of health. And WHO must readapt and reconfigure. WHO has a clear mandate to lead on some complex transnational threats such as emerging infections, antimicrobial resistance, and non-communicable diseases, and it must exercise effective public health diplomacy. In fact, this was a term coined by our host, Ilona Kickbusch. In addition, WHO must also reinterpret its role because up until now it has been engaging with the ministries of health. But in the new era of the Sustainable Development Goals, we know that many sectors other than health deeply impact health status, and that decisions as overarching as universal health coverage are taken not by the ministers of health, but by heads of state. And this has implications for WHO's capacity to effectively advocate and to forge multi-sectoral partnerships where it becomes a force multiplier by playing its unique normative role. And that's the first point I want. Secondly, in terms of political leadership, I think there is a paradox that we need to address. Because on the one hand, expectations from WHO have increased, but so have the financial uncertainties. So the next Director General will not only have to make a very effective investment case, but will also have to stand behind it and communicate it very effectively to get the necessary support. Thirdly, I'd like to outline that there is a very fine balancing act that the World Health Organization has to play. WHO is a member state government organization, and the role of the Secretariat as such is to execute policy. But then on the other hand, WHO is also an independent guardian of health, and it must play that political role and stand by evidence-based positions, even when they have political implications. In the 4th place, I would like to outline that there is also a very important political role to be played internally within the organization in order to break silos, in order to bring reforms to fruition, and also to overcome impasse when member states get polarized on issues, which is something that we see very often. Of course, in terms of drawing the line, WHO has to very clearly firewall its normative work from the many non-state actors which have to be and which must be engaged in order to deliver on the Sustainable Development Goals. Excellencies, ladies and gentlemen, I have led on hard issues all my life in ways that are sustainable and constructive. I have operated in some of the most difficult environments, and I have delivered results with transparency and integrity. And I believe that with my broad experience as a medical doctor, as a researcher, with deep experience in government, in civil society, in the multilateral system, and building institutions and working at the grassroots level, I will be able to work with all of you to deliver on this very complex agenda. Thank you once again for having us here. It is forums like these which pave the way for WHO to enter into this new era where its political role becomes hugely important. Thank you.
Thanks so much. Thanks. If I can ask people not to applaud, please, because it will actually cut into our time. We have lots of very good answers.
Yeah, thank you. The opening because of the principle of candor, the opening question was different, but still I can cope with the revised opening question. The vision I think whoever and wherever someone is should not matter in relation to accessing the basic services needs that the person needs. Because we have been saying health for all, starting from 1947, then 1978, now with the advent of SDGs 2050. So we have to work our job. That's the vision. Then the 5 priorities I have, then the first one may be related to the vision is universal health coverage. And the second is emergency preparedness. And the third is focus on women, children, and adolescents. And the fourth is climate change and environmental change. And the fifth, we need to transform WHO to achieve the 4 priorities. Then I will go one by one. On universal health coverage, I believe that all roads should lead to universal health coverage. Breaking the financial barriers, breaking access to quality health services, the barrier, and breaking the barrier to medicine. And then that universal health coverage to address communicable diseases, non-communicable diseases, and those countries deal with triple burden, not only communicable and non-communicable diseases, but disasters too. And on the second, the emergency preparedness, I think the world is waking up now, and we have to be moving with sense of urgency, because we're sure that there will be a next attack by a pandemic. We may not predict everything, but we can prepare. So we should implement the reform that was endorsed last May, and also the international health regulation with sense of urgency. Then the third is women, children, and adolescents. Marginalizing women and children is dangerous. Marginalizing women, we lose out today. Marginalizing children, we lose out tomorrow. Double loss, we shouldn't allow. Losing today and tomorrow. Fourth is climate change. This planet will move on whether we are in or out without us. The danger is real. And WHO should be very serious on this and should be very open both in mitigation and adaptation strategies that the world had already agreed. And in transforming WHO, we have to make WHO more effective doing the right things, more efficient doing the right things right, more accountable with internal and external independent assessments, and make it the WHO of the 21st century. And having the experience, 12 years as health minister and then foreign minister, I believe that I have the technical and political diplomatic skills to lead this organization. I'm not telling you my talking points. This is my life. This is my passion. And I believe I can make a difference if I lead this very important organization. And it's also because I believe in this organization. Of course it has many challenges, but it's still relevant. When I visited Liberia some months ago, of course, WHO failed in Liberia, but the Liberian officials, Syrian, believe that WHO is still relevant and important in this multilateral world. And they say, we need it, especially if you focus on building country capacity and building WHO's capacity at the front line, which is the country offices. Thank you.
Thank you very much. So politics is about looking at the way in which power influences people, and then it's about using power to change their situation. The good use of politics, which we're discussing today, is using power to ensure that people are able to be healthier. And in order to be political for health, we must always be skilled at engaging with politicians of all kinds to ensure that in the process they use their power for the good. I'd like to start by talking about a little bit about the politics of health. We know that people who are without power or limited power are less easily able to ensure their health. And that is manifested through their inability to access care or their inability to get clean water or food. We know that health workers who lack power are unable to defend the interests and the rights of the people who they seek to benefit. We know that UN organisations are required by world leaders to help ensure that power is used for the common good. That's what the Sustainable Development Goals are all about. But think back a bit. That's what the primary healthcare movement is all about, that many of us have been working for since the 1970s. And WHO is right at the centre of this because health is central to sustainable development. Health is right in the middle of all the efforts to try to ensure a world that can nurture humanity and human well-being for generations to come. So WHO is needed to do that, but there's one special last word I'd like to say, which is that the Director General of WHO has a unique role. Because although the organisation is bounded by its member states, and they exercise political control over what it does, the Director General is empowered by the member states to act for the best interests of the people. And so the role of the member states on May the 25th is to identify the Director General, whose track record and value system shows that she or he is best able to harness political power for the good of everyone, at local communities, at sub-regions, in regions, and globally. Thank you.
So David, I would like to take you up on what you just said. And I think after this, Dr. Tedros and Sanya as well. Are you a political person? How will you manage the power play? You have to engage between WHO, the UNSG. How will you manage the political club relationship with G7 and G20s?
I started my professional life 40 years ago working on the issues faced by people when they were powerless and unable to experience good health. And right at the very beginning, as a medical student and then as a young doctor, I saw that politics and health are very closely intertwined. And I worked in that arena in a total of over 50 countries, in all continents, learning the relationship between power and health, particularly seeing just how important it is that politicians do value the rights of people to enjoy good health and to have the wherewithal that's necessary. Later on in life, working with my own government and then with the United Nations on more than 10 big international issues, including avian influenza, as we were discussing earlier, I became even more convinced that health professionals who are going to be effective and exercise change have to be able to operate in the political media, not as politicians, but as people who can work with the political environment to get the best possible results in a way that is transparent and accountable. And that has been the story of my professional life. Working at the local level, what we sometimes call at the front line, and then also working at the policy table with the policymakers and the politicians to make sure that the needs of the front line are put first, and that we really do get rights realised and health outcomes achieved.
Thank you very much. I mean, this is a very important question. Then political, I'm a politician. I'm a member of the parliament, and I try to look at things politically. And as Minister of Health, and later on as Foreign Minister, all my life, especially as a politician, has been to see things politically and nothing else. Then I will give you maybe a story when I was Health Minister. I believe that politics is very, very important because it's political intervention that can bring surgical intervention, and I'll tell you why. We studied our health system in Ethiopia, and we saw that women were very marginalized. They were not using services. And we tried to understand what the root cause of the problem was. And the reason was, if you go to the root cause of the problem, inequitable distribution of power that expresses itself in one of the dimensions. You know the dimensions: political, economic, social, and cultural. Mainly, in our assessment, we found that the cultural dimension was what was preventing women from using the services. And because women in Ethiopia, especially, most of them are rural, and they cannot talk about sex, or they cannot actually talk about even decent family planning services with a male service provider. This is because of the cultural taboo. So how power actually expresses itself in terms of culture. Then we said we need to do two things. One, we have to address the gender equality, but that will take us long. While doing that, women in parliament and also giving them ownership and so on. But on the other hand, we said we should do something we can do today, because these women, because of cultural taboo, they shouldn't be prevented from having access to family planning. They should decide. It's their life. And then we deploy, by design, 38,000 health extension workers to serve these women to have the privacy of discussing reproductive health and get what they want. So as WHO Director General, I will see the root causes of challenges and also see politically, which WHO is missing: political understanding of situations. Thank you.
Well, in terms of your question, am I a political person? First, let me outline what politics is and what my understanding of politics is. It is about building institutions and systems. It is about cultivating a cadre of individuals who have the capacity to exercise power in a fair, just, and equitable manner. But because politics is also about gaining access to representative institutions, there's a certain amount of power play inherent to it. Unfortunately, when we refer to the word politics, it is the power play which eclipses the actual substance of what politics should be about. It is actually something very noble, but it's considered to be something very different. You don't have to be a politician to exercise politics for a particular cause. I think one of the most important political roles you can play is as a civil society advocate, which is what I've done all my life. To me, politics is about effective advocacy. To me, it is about leading on hard issues in ways that are sustainable and constructive. To me, it is about speaking truth to power. And to me, politics is about effective communication and persuasion for the right causes. And in terms of your question, yes, I've played political roles all my life.
Let's talk a little bit now about relations between different countries and the role of the WHO. We're seeing from some pretty significant countries a lot of differences around ideology, around certain programs and policies, around momentum on funding international health programs. So how do you see yourself acting in order to ensure collective political consensus and funding for global health institutions and programs? Maybe David to start.
Thanks very much indeed. First of all, don't let anybody tell you that there's no money around for global health. This has been a really successful recapitalisation of the Global Fund. in Montreal, September last year. And it's quite clear that if we look across middle-income countries, spends on health are on the increase as well. And what really matters now, if we're looking at the finance for the World Health Organization, as well as for the other instruments for financing health, is always to demonstrate that they're capable of achieving value for the money that's invested in them. This is something that I've focused on all my professional life. Raising resources in order to ensure that outcomes are delivered and that people benefit as a result. The equation is quite simple. An investor looks at a proposition and says, is this one that's going to help us to achieve better results? Malaria. We watched in 1999 a situation together with David Heymann where the malaria world was in disarray. And within 5 years, buoyed upwards by really good science that showed us what were the key interventions for malaria, we were able to identify 4 basic steps that, if implemented worldwide, would transform the situation for malaria for people throughout the world. And by getting malaria into the Global Fund, a little bit of a fight at the time, it was possible to start getting some resources moving. And then through the partnerships like Malaria No More, we now have a situation where there's been a halving, a greater than halving of malaria mortality, particularly among young people in Africa. And this shows that it is possible, if you demonstrate the good results, to shift from an idea through to a program, then to outcomes. It can be done in many other areas, Andrew, as well.
Well, thank you, Andrew. There are 2 parts to your question. One is the question about polarization around issues, and the second one is about funding. So in terms of polarization, yes, WHO's governing bodies are 194 countries which come from diverse positions. We've seen the parliament get hung at several times. We've seen membership get divided on creating a stalemate, creating an impasse. That is precisely where the Director General has to exercise leadership. You know what the agenda that's coming to the table. You have to preempt the kind of discussion that will transpire at the table. You have to broker and negotiate at the back end, and you have to envisage an ideal outcome. You have to try to bring member states to a point of convergence even before they come to the table. I've experienced that in my role as co-chair of the WHO Commission on Ending Childhood Obesity, where the member states, the private sector, the civil society were at different ends of the table, and most of the work was done to get their trust, to explain evidence-based positions to them before we came to the table. I don't think it's an option to put issues on the table in front of 194 members and tell them to sort it out themselves. So there's a lot of diplomacy that needs to come into effect at that level. Also, in terms of polarization, I think the time for niceties in WHO is over. We have to understand that we are up against some very complex threats which are not health issues. Tomorrow, if a Spanish flu-like pandemic hits the world, not only hundreds of millions of people will die, markets will go into slides, economies will buckle, we will go into global recession. And I think that the Director General has to continue to issue these wake-up calls in order to get member states to point of convergence on critical issues. And not all of them are critical issues, so if there's a certain amount of diversity and polarization on non-critical matters, you need to force them to converge at all times. The second part of your question about funding, I'm not going to touch the particular point that you're encouraging us to talk about. In terms of funding in general and the WHO situation, I think it's critical that we espouse transparency, value for money, cost efficiency, and all these approaches. In addition to that, we have to appreciate what the core problems are. And one of the core problems is that WHO is reliant on too few donors in a very uncertain environment. The other issue is not the aggregate funding, but the distribution of what is technically called assessed voluntary contributions, which doesn't allow the organization to be proactive or priority driven. I know the red is flashing, but if I can beg your indulgence for another 30 seconds. I think it is critical that the new Director General invests in a new resource mobilization strategy, backs it up with an appropriate communication and advocacy plan, and gets on to address some of these core challenges. And of course, there's this whole menu of options across the value chain in terms of how innovations can kick in. And we must not forget that when it comes to a country level, one of the innovations is also to give more domestic mobilization resources to bring to bear that a lot of public health interventions are actually revenue generating and are very cost effective. So you have to approach the funding issue from different vantage points. And sorry for taking extra time.
Tedros, how would you mobilise both politically and for funding?
Yeah, thank you. On polarization, I think it's very important, by the way. I chaired Global Fund for 2 years, 2009 to 2011, where you find the government, the civil society, private sector, everybody represented. And I have seen it how you can steer. If you go for win-win and you're really honest in building bridges, it's not difficult. Polarization is how the leader himself or herself handles it. The polarization can be addressed. So I don't want to say more than that. I think my experience in Global Fund can say many things, but in addition to that, as foreign minister, in conflict resolution, helping countries to address their problems. I can even be, without sounding being immodest, I would say that's my advantage. And then going to the funding issue, I think this is very important. First of all, we should understand as a global community that we are on the same boat. And the only way forward is solidarity. And whatever we spend is actually for our world or globe to be better. And we need to always be on a morally high ground. You see populism and so on spreading like whatever. That's dangerous. The morally high ground will keep our planet sane. So if we understand about financing, I think we should depart from that perspective. Why are we paying money as a global citizens, It's just to save our planet, to bring equity, to really save it, to help humanity. By investing money, we can avoid terrorism and so on. So WHO, in terms of financing, the last one I would like to say is, should understand the mega trends, how the world is changing, should have a political mind. The world is changing tremendously. It's changing from unipolar to multipolar. There is economic crisis, there is terrorism and conflict, there is climate change. And WHO should understand this and reorient itself. And the financial part can be seen in relation to this and have the right messages to convince member states and others to contribute. But in terms of strategies, we have a lot. But on financing, I think we shouldn't forget and we shouldn't make a mistake that WHO should start from adding value, just in the money that it has, adding value, and then expanding the base and the rest of the country, increasing assets contribution. And I know how the regional, the sub-regional political organizations work as a foreign minister. I know how the regional political organizations work. I know how the global was New York in Geneva work. And I can start immediately, actually. I know how to open the door without any exaggeration to make that happen. Thank you.
Okay, all of you talk about actions and achieving the SDGs cannot be without actions. And SDG Goal 3 are loaded with the intersectoral work, the interlinkages between each of the goals. I would like to highlight on the point between climate and health. How do you think you will carry WHO with the vision of tackling climate and health? I think Tedros, and then David and Simon.
Thank you. First of all, climate change is one of my priorities, environmental change. I said it earlier, we're on the same boat. I think we shouldn't rock the boat, especially climate change is serious. If we rock it, then the planet can go without us or with us. The choice is ours. On climate and health, to the specific actions, one thing that I see that WHO is actually less active is focusing on mitigation. WHO always advocates for prevention and promotion, and rightly so. And it should continue to advocate on promotion, well-being of humanity, and also disease prevention. And if that's the case, then WHO should be more vocal on mitigation, because promotion and disease prevention is actually in mitigation, not in adaptation. Adaptation is after it's too late. And WHO should be at the forefront to advocate against carbon release, reduction of carbon release. And two, in trapping carbon that's released, that's prevention, that's promotion. It's not after it's too late. Of course, it should work also on adaptation, but it can be over. I was in Norway last week, and I was very happy to see their long-term plan and also what they have done so far to get the diesel using cars out of the center of the city. That's reducing carbon emission. And then you can complement that with the vast afforestation programs some countries are doing to trap carbon. And WHO should be a strong advocate on that. And the second, on adaptation also, that's its territory, has to do serious studies to understand how climate change and environmental change are actually affecting health, and to have clear guidelines and standards to address it. Thank you.
Thanks very much indeed. I've been working a lot recently on the Sustainable Development Goals. That's a gift to the world from world leaders, provided for us in September last year. It's a plan for the future of people and the planet with 17 goals and 169 targets. Goal 13 is the goal related to climate change. Virtually all the leaders with whom I've spoken are agreed that if that goal is not met, then trying to deal with the rest is just academic. We're a prisoner inside this changing climate. Fortunately, there are some countries that have realised and who have already made a decision to decarbonise and to try to have an inflection to the point where their carbon release becomes less than zero certainly by 2025. And one of those is China. So let me just spend a couple of minutes on China. They've decided that they're going to make absolutely certain that their energy production is carbon neutral before 2030. Now, why have they done this? Because there is so much concern in China about air pollution, particularly in some of the cities. And where's that concern about air pollution coming from? It's coming from the health professionals and from the public, who are seeing the impact of air pollution on child health. So I kind of agree with Tedros, but I want to make it really strong. The WHO has to speak out about the impact of climate change on health, and use that to stimulate rapid decarbonisation, and link to that increased resilience, so that people, when they are experiencing climate change, don't suffer from increased diseases, increased levels of dengue, increased levels of chikungunya, and increased levels perhaps of Zika as well. So let's make it absolutely clear. WHO has central importance in working on climate change, both to support decarbonisation and development and to support greater resilience.
Completely agree with David, and just to build further on that, because I've seen the ravages of climate change firsthand. I come from Pakistan, where we had a flood in 2010, size of Italy, if I'm not mistaken. Massive ravages. I have had the privilege of serving on the Planetary Health Commission of the Rockefeller Foundation and the Lancet, where we took a more holistic view of the situation expanding it to broader environmental determinants in addition to climate change. And that understanding led me to peg the health effects of climate change as one of the 4 programmatic priorities in the program, just as Tedros has as well. Now, in terms of tangible action in relation to what WHO can do, first of all, I will fast track the process of WHO's pre-qualification, which will enable it to tap into climate change funds. There are a number of boxes to tick, and WHO must do that as soon as possible. Secondly, in addition to its health system strengthening work, and in addition to the focus on universal health coverage, WHO must pay attention to health systems resilience as well. And this becomes all the more important in certain parts of the world, such as the Pacific Islands, where climate change and the threats as a result thereof stand as the #1 problem on the agenda of the governments. So I'll be very sensitive to that, and because of that, I have committed that if I have the honor of being the Director General, my first trip would be to the smallest Pacific island to show my solidarity with them. Also, the climate change, the work around climate change also cross-cuts with disaster preparedness and with multi-sectoral partnerships, and how you need to uniquely look at the situation in every country and help them build those relationships with different government agencies, with the private sector, have contractual arrangements, well ahead of time. Although this is a relatively long-term risk, but you cannot predict it, but in terms of preparedness. And then, of course, as David very rightly said, there's a huge interplay of climate change with emerging and re-emerging infections. WHO has a responsibility to be very active in terms of surveillance and to see where infections are re-emerging, where there are new infections, what kind of requirements there are in terms of vaccines and diagnostics and medicines, and how to engage with the industry and to pass on that information and to make and to do whatever is required in that broad space of work.
So political leadership is obviously about making priorities, sometimes quite painful ones, making choices. WHO does a huge amount: AIDS and infectious diseases, pandemics, strengthening the workforce, NCDs, family planning. What would be the one area that you would consider most important to strengthen during your leadership period? And what would be the one area that you might deprioritise? Tedros. Okay, David, then. All right, David. I'll give you time to breathe.
Did you just pass it to me?
One very important, no, it will not be taken from you. One very important thing is we shouldn't have any double standards. So when there is, we should complain. So I was the previous one, so somebody should be the first.
So I've got a little scorecard here. Who's gone over their time? Do you want me to finish?
Candor is very important. We should start it today.
Candor and respect, everybody, respect. And that's what we're into. We just to tell you a little secret, we really respect each other a lot. And although we're put up here and supposed to fight, we actually get on really well. Thank you for coming on and having a bit of a laugh with us. And so with that, I'm just can you reset the clock? Thank you. One of the challenges of being Director General of WHO is that you have to do what you're told to do by the member states. And so although you might want to deprioritise a particular issue, let's say, for example, this is just an example, please don't tweet it. Let's say you're going to try and deprioritise oral health, teeth. You say, well, that's not so important for saving lives. You will get a lobby of oral health practitioners coming and giving you a bad time within a very short space. So there's not an easy way to deprioritise in WHO, really. So I'm going to do it differently. I don't want to stop doing particular lines of work, but I want to do all the lines of work differently. Because I actually think as the world's standard-setting organisation for health, WHO's work is actually immensely valuable. It's the only organisation that has the legitimacy to provide universal standards for what everybody should be able to achieve, and also what should be happening in relation to every health condition. And it also, because it's got 150 country offices, it can adapt those standards to the interests of different countries. But it's the only organisation that's come. So the obvious way to work is to say a little bit of WHO linked up with a lot of some of the other partners who are working on health, national governments, research groups, civil society, faith organisations, then you get your impact. So my answer, Andrew, and it's not, I'm afraid, the answer you wanted, is I want to make WHO catalytic and to shift it from being an organisation that specialises in a lot of projects to an organisation that focuses on getting standards implemented through others everywhere.
But a risk also of thin priorities. Tedros, would you, can you be a bit more focused? Could you cut something? Could you refocus on something else?
That's something, yeah. Not on prioritizing. By the way, it will address the deprioritization also. If you select in your prioritization, you select the right priority. Universal health coverage is central. If we take that as a center of gravity, then priorities for countries will always differ and use that universal health coverage to address their needs. Everything should not come to WHO. So I think focusing on universal health coverage, making progress on that, will actually address what to prioritize also at the global level. So my priority is universal health coverage, and all roads should lead to universal health coverage, and that will address all the barriers that we have. And in addition to that, that will address the needs of the countries, because countries have their own respective priorities, and countries have, and regions have their own priorities, and that will also address the local needs. And the other issue we need to understand here is on deprioritization and prioritization, we have to be honest. Even if I go with a prioritization or deprioritization, you know, budget issues and prioritization issues are up to the member states. And when I say I will do something and I will change this or that, the member states should also change. And we have to start challenging member states not to come with non-serious resolutions and priorities to the WHO. WHO on some issues is wasting its time. I have seen, as a health minister for 8 years, I have seen a waste of time, a waste on something that's not really important to be discussed at the WHO level. So member states should be really honest to themselves and discuss some of the things they shouldn't discuss. They should be focused. They should select priorities, focus on select issues, high impact, make a difference. So it has to be both ways. I'm not just saying I will, I will only ask member states. Of course, I have to change things, but it takes two to tango. Thank you.
Sandra, you have to respond to member states, but you can also set out an agenda yourself towards them. What would you prioritise?
I completely agree with you. You see, international and especially multilateral organizations have specific mandates, and you just can't strike things off. You can prioritize based on what is more urgent, based on what is more critical. But looking at WHO, it has two roles which are its exclusive domains. It is its norms and standard setting role, and it is its role to be the steward in cases of emergencies. And emergencies are not just infectious outbreaks and emerging and re-emerging infections. They can be biological, they can be nuclear, they can be chemical, they can be accidental, they can be terrorism related, and all of them constitute public health threats. So these two are exclusive mandates of the World Health Organization. Of course, it has to be the steward for health, and it has a convening role and the rest of it, but these two are critical. And in terms of prioritization, of course, it is the emergencies response that I would prioritize, but you have to be mindful of the fact that under the new framework of the health emergencies policy, which has been stipulated and agreed by the member states, there are mechanisms of invoking the wider humanitarian response in cases of a large-scale public health emergency, where WHO's role is to set guidelines and to play a normative role. So we have to be mindful of that. But that notwithstanding, WHO does have an operational role, and we must prioritize that. In terms of what I will deprioritize, I'm very clear on what I will deprioritize. I will deprioritize politicization and duplication and fragmentation and competitive behaviors and collusive behaviors and silo thinking. This is something I will completely deprioritize and get rid of. And I'm serious when I say this, because this is what I have done all my life. In terms of the other deprioritization angle that you are encouraging us to talk about, I think WHO is the technical steward for the health sector, but it does not mean that it does everything on its own. And even in my vision for a new WHO, I've talked about its exclusive domains, about partnerships and being a force multiplier in those partnerships. So if there is a collaborating center that can lead on a specific stream of work, I will have no hesitation in stepping back and empowering them and boldly owning. Of course, there are quality criteria that they have to follow. If there's a geographically dispersed office which is taking the leadership on a particular area, why should the headquarters duplicate? I mean, why not distribute global functions to the extent possible where there's a comparative advantage between the regional offices? So it is the duplication and fragmentation I'd like to deprioritize and eliminate in this financially austere environment. And of course, I will make sure that I leverage the strengths of partners to the fullest.
Okay, based on all of your answers, I think we can see that all of you realize the direct relation between prioritizing, deprioritizing, and popularity. So I would like to push the point further. Yes. I would like to push the point a bit further on how. How will you prioritize between tackling on the longer term investment, focusing on system reform, and the quick wins that are so seemingly easy to grab while you are taking office? Please, Sanya, and then David, and then Tedros.
Well, firstly, in terms of prioritizing, deprioritizing popularity, I know what you're trying to say. There is a dictum which says you either want to keep the job or you either want to do the job. And I want to do the job, even if it means agreeing for one term, even if it means the member states agreeing and changing the constitution of the Director General to one term. A lot of times in multilateral organizations, if a head is eligible for a second term, the head is playing very safe, not to step on toes, to try to gain favors because of reasons that you understand very well. This is not why I'm going to leave my very comfortable home in Islamabad and come here if I have the honor of being elected. I'm very clear, I will come here to do the job. I will not be a bull in a china shop. I know how governance plays. I know it is a member state governed organization. I know how a CEO has to behave. But I will be very active on reform and in making the changes that are required. Because as I said earlier, the time for playing safe in this organization is gone. We are really confronted with the situation. And we have to understand and appreciate the gravity of that situation. And the new Director General has to be prepared to play a very active role. So that's in response to your first question. In terms of, here I'm having problems with my handwriting, you said longer term investments in system reform. Well, if you're talking about the member states, and if you're talking about universal health coverage and health system strengthening and building institutions and systems, WHO's role is technically and politically advocate and to help them technically to advocate for change, to broker the right partnerships. But it is ultimately up to countries to mobilize resources domestically and to develop the political will to take the right decisions that are required for system strengthening. If you're talking about reform internally within the organization, of course, there's a reform that is currently underway, and I've committed in black and white that I will continue with the momentum. I have also committed that I will introduce a new generation of reform with member states concurrent to drive a culture of results and accountability and transparency. And of course, I have signaled intent to embark upon an independent evaluation with member states concurrent to explore WHO's systemic and inherent weaknesses, which have not been the focus of reform up until now.
Thanks very much indeed. Just let me start, if you don't mind, on the prioritising and popularity business. Just to say, in my experience, all the work that you do in the international system is difficult. And most of the work that you do is frankly not popular. If you're trying to deal with crises, particularly disease outbreaks, it's difficult. Let me take you with me to West Africa, August 2014. Ebola had reached Monrovia. We had the numbers of cases doubling every 3 weeks. We had people arriving at treatment centres and dying at the treatment centres because there was no space to take them in. We had an excess of bodies building up in the mortuaries because the services couldn't bury them. And then we had to move to cremation, and that was extremely unpopular. Yet at the same time, not in West Africa itself, but elsewhere in other parts of the world, we had leaders telling us that we were exaggerating the problem. Exaggerating. And it was only because we were able to show them the evidence, the figures, the numbers, that we were able to get a result, and we were able to bring about a shift in the approach that we were seeing then to that particular outbreak. That's not uncommon. It's quite frequent when you're working on outbreaks that you are having to take some very unpopular steps. Unpopular with governments, unpopular with business, unpopular with societies. Now, of course, in practice, you try to get it right, and you try to make sure that people are working with you in dealing with the priorities, whether it is how bodies are buried or how hospitals operate. But the reality is that an awful lot of the work we do is not popular. And we have to be ready to do that. This is absolutely not a popularity contest, running the World Health Organization. And beyond that, I'd like to stress to you that although sometimes people think there are quick wins in global health, that's, again, a bit of a fallacy. Because if we're trying to work for systems that enable poor people, vulnerable people everywhere, to access healthcare, we are often having to move against the grain with the way in which health systems operate. And again, that's the only way we can work. Thank you.
Yeah, thank you. On reform, as many of you know, as Health Minister, I designed the reform, implemented it, and also saw the result because I have served long enough to see the result. So I was lucky. So with reform, I can start immediately. And I know what the challenges are when you start a reform. But the reform I did was very surgical. And of course, with good result. And on reform, maybe on priorities, long-term investment versus quick wins. As long as you have the quick wins aligned with the long-term investment, no problem. So your quick wins should actually focus on high-impact long-term investments also. So that's the issue. I think David was worried about quick wins, but as long as the quick wins contribute to the long-term view, to the strategic solution, it's good, and you should really collect the low-hanging fruits. And Maybe specific to this is in emergency preparedness. We have the IHR. We have already the resolution passed last May. We have to start implementing it. And we can get something with this problem. Because the world should operate with a sense of urgency. We have no option before the next strike actually, with the next strike happens. And antimicrobial resistance, the same thing. We can do some low-hanging fruits can be collected. We have to do it with sense of urgency. So I see the quickness in relation to the strategic issues that we're solving. Then on priorities and populism, one thing I would like to remind you, we were discussing, and then about emergencies and so on. Then in my vision statement, that is about migration, space people, and so on. I put that because of it's from my heart. And some people told, okay, this is a fashion, so that's why you put it. No. After the world has witnessed a child that was washed on the beaches of Turkey, you remember the Syrian boy? I still remember the bright red shirt and blue shorts and lying on his face down, and still the police collecting him. When the world has seen that, not to put migration as a priority is dangerous. Morally, where are we? Where are we? I told you earlier, without a moral compass, this world will only get into trouble and trouble. As a foreign minister, I have said, 2015 was bad, 2016 was worse, 2017, I don't know what's solving. It's actually deteriorating. And without moral compass, we cannot solve it. And putting migration as a priority cannot make anybody populist. That child, Alan Kurdi, maybe some of you remember the name. It's sad. It's sad. And 65 million refugees. It's none of their problems actually to be refugees. They could have preferred to be at home. They were forced. What are we talking about? So prioritization based on reality is very important. And the moral compass to identify the priorities is also important. Thank you.
So we've talked a lot about governments. Let's talk a little bit about other influences around the WHO, so business and philanthropic organizations. So both in terms of funding and governance and relations with business, which of course could be pharmaceuticals, it could be food, drink, tobacco, and philanthropic organizations that often provide funding and may change priorities. How would you cope with those two different entities? Senator.
Well, thank you very much. In terms of businesses, I think there is now a very explicit mandate to engage with the non-state actors, and that mandate comes from the Sustainable Development Goals and the narrative that is embedded therein. Of course, the governing bodies of WHO have negotiated FENSA, which is a framework of engagement with non-state actors, which provides an umbrella for engaging with four categories of non-state actors: businesses, the private sector, civil society, philanthropic organizations, and academic institutions. Also, more in line with non-communicable diseases, there is a global coordinating mechanism, which is a multi-stakeholder platform put together by WHO to facilitate engagement with businesses and with civil society. So in terms of the mandate is there. In terms of the institutional arrangements, those have also been established. I think we need to be clear on why we need to establish those relationships. We need to be clear that in order to implement the Sustainable Development Goals, we need to engage with what is broadly called the non-state actors, particularly businesses and the civil society. And I'll give you a few examples. For instance, when you talk about the pharmaceutical sector, and you talk about prices of medicines, you've got to engage with them. You've got to, the whole notion of fair pricing, you've got to engage with them. And WHO and a number of partner organizations are holding the Fair Prices Forum in May next year, this year actually, in order to give guidance to countries on to engage with the industry on fair pricing of generics. And so you need to bring them to the table. You need to bring the industry to the table to communicate priorities to them in terms of new vaccines, new medicines. You have to engage with them to address the issue of market failure in relation to neglected diseases and poverty. So there is this whole area of engagement with the pharmaceutical and the device industry. And of course, in terms of food and beverage, in terms of implementing the Global NCD Action Plan, there are a number of actions they have to take in terms of responsible marketing, in terms of reformulation, and nutrient labeling. The list can go on, and they need to implement policy, and they need to be part of that discourse. We are towards the health system side and look at service delivery in many parts of the world, especially the one part of the world that I come from. 80% of the health service delivery is by the private sector. How are you going to deliver universal health coverage without harnessing their outreach, without creating the regulatory frameworks in which to do that? I mean, the list can go on and on. Universal health coverage, and if one of the mechanisms is to broaden the base of pooling is through the insurance route, then most of those companies are in the private sector. The whole host of innovations that are happening, the WHO needs to champion and harness and mainstream and exercise systems leadership to address issues of quality, of equity. There are a whole range of competencies that are out there in the private sector that WHO needs to tap. As I said, it must firewall its engagement from the normative work, which is so critical, and that is one of the fine lines, very clear lines it will have to draw, but it must engage with them.
I think so.
Your other point is about the civil society.
We can come back to that in a second. Yeah, Tedros, so talking about particularly philanthropism business, have they got too much power? What would you like to see in terms of balance in relations with WHO?
In terms of, I mean, this is a very important question. One, the world is, the challenge we're facing is getting complex. And I think the participation of all stakeholders is very important, and it should be welcome. It's with solidarity, and I think working together that we can achieve better results, because we can create synergy. That should be the basis. Then, when we work together, then there should be the rules of the game. We need to have a code of conduct, because there will be conflicts of interest, especially when you talk about the business sectors or the private sectors. And as what Sanya said, especially the normative functions should be firewalled and properly protected. And the code of conduct should be adhered. Here, it's not a matter of documents only or guidelines, but I said it earlier, I think from all of us, the moral high ground is also required, a combination of the two. Straight jackets, standards, but moral high ground to save this world. I think that's very important. Otherwise, we should use it as opportunity. And there are very good ones who really help it. We should be actually grateful. They're helping. We should be grateful of that. And we should encourage them to help. And on areas where is this agreement with the private sector or the philanthropists and so on, still we can discuss, we can engage. It should not be a condition actually not to discuss and address the challenges. Maybe if you talk about, for instance, you take one example, the pharma industry, there were many good recommendations. The high-level panel's recommendation was a very good opportunity last year. I think we have to continue working on that. De-linking research and development from cost is very important. Surveillance of price is very important, and negotiating with the private sector regularly. And continuing to negotiate on the TRIPS is very important. And building manufacturing capacity in countries is very important. And the regulatory functions. Of course, among a long list, I think this could be the most important ones. But if we focus on the issues, I know we can work together, focusing on the issues, addressing our challenges or differences, and going to a goal that we all want to achieve. Thank you.
Thanks very much indeed. I want to try an experiment. I want to say I agree with everything my two colleagues have said. And then I'm going to just build on it. We are in a world where there are, as Tedros has said, a lot of really big challenges. And it's our responsibility as international public servants to try to make certain that no opportunity is lost to make a difference to the lives of people who are suffering. And we've seen so many exciting opportunities that have actually been taken in the last few years through partnering. Malaria. Medicines for Malaria Venture has been set up in this city and has led to blue skies research that's contributed to new kinds of projects, particularly combination therapies. And then building on that, the development of Coartem in a partnership with a local pharmaceutical company that's transformed survival of children. Or let's try another example. In the food sector, the work that's being done with the food industry to shift to more nutritious products that are safer and healthier for young children to try to reduce excessive calorie intake. Well, let's take women and children's health. Sitting in the front is the person who I identify as the leader of Grand Challenges Canada, who's advancing work for women's and children's health through links with the private sector and innovating to leapfrog. Or then companies that are working, as Sanya said, to help with the delivery of primary health care in Africa through helping to establish centres that are equipped with modern equipment but financed in combination with the private sector. If we get the principles right, as Tedros says, this has to be a way to go. And it's a way that can make such a difference to people's health and livelihoods. So I am trying to suggest, Andrew, that it is possible through partnering with business, with philanthropy, to make an incredible difference. And this is where WHO has made a great impact, can make an even more impact, provided we get the context and the conditions right. But we should welcome it as the way forward.
So in such a strategic setting, the WHO new DG will bring forward WHO into what we call 21st century WHO. And this also requires transition from the old style financing, if Andrew talked about private sector collaboration, into the new style of sustainable investment in finance. How will you do this? How will you move forward with this? I lost track about who's who. I don't want to be complete. Is it Sanya's turn now?
Sanya and Tedros.
And then it's you.
So my colleague Tedros, just to say I'm honest, there you are, ladies and gentlemen, he's honest. So, well, I mean, my trouble is that when you say old style and new style when it comes to financing, I get a bit nervous what you're talking about, because there aren't too many magic ways of financing development. And we know that. Those of us who've been in this area for years know that we depend hugely on encouraging governments to increase more of their own national income in development. We depend hugely on getting support from concessional financiers, the banks, and also the donors. And we increasingly look for impact investors in the private sector who are prepared to bring some of their money in to support development outcomes and perhaps get a return on it. And the basic rules are the same always, which is to demonstrate value for investment. That's the point we made earlier. And I think that the future, the new WHO, will need to be even better than it currently is, and it's pretty good now, at actually providing transparent indications of what you get for your dollar, not just in terms of what WHO produces, but as I've said before, through its catalytic impact on others to make sure that the best possible outcome is achieved. So in the WHO of the future, which I hope to be able to direct, I will put a lot of emphasis on A, transparency, B, measurements of impact or results, and then C, presentations to investors so they can see what they get. Now we have one last point, which is WHO is owned by 194 member states. And there has been nervousness on the part of some member states that these kinds of investments in health brokered by WHO actually are not perhaps ideal. And so I would really want to be sure that all this is done with the full engagement of the whole membership, so that there's no sense that one is after creating markets for one particular group of investors.
Yeah, on SDGs and financing, I'm very fortunate actually to be part of that process. As many of you know, I chaired the Finance for Development conference in 2015 July and led the negotiation to agree on Addis Ababa Action Agenda, which was the mechanism to finance sustainable development goals. And I think the first thing should be we have to walk out. We have to implement that document, Finance for Development Mechanism. It's a good one. The whole world agreed. The negotiation was very, very, very tough. But finally, it shows the global commitment to finance SDGs, and there was a document agreed. So I think that's very important. And then the other element we have to see is WHO should support the many organizations that the new players like Global Fund, Gavi, that are helping in global health in the replenishment of funds. Whatever money we have in the world for health belongs to WHO. So WHO should not consider Global Fund or Gavi or others as competitors. They actually work for WHO. And the Director General should be very actively supporting those organizations when they raise their funds, because their money is at the end of the day for the global health agenda. And there could be other things that we need to do. I raised it before, maybe briefly, is the value for money. The value for money can come, especially with the prioritization. We have to focus. We need to prioritize and try to focus on high impact programs. By doing that, we can add the value for money that has been already indicated. And the advantage of that is when you have priorities of programs, and whatever administrative cost you have will follow these programs, and if there is any fat, unnecessary cost, administration cost, it can be cut and used for programs. And expanding the donor base is very important. The Director General should actually be actively involved on this and should lead this. Actually, I consider the Director General as one of the roles should be in fundraising for not only just WHO, said earlier, it should be to raise funds, whether it's through World Bank, through Global Fund, through Gavi or other organizations, that to increase the availability of the envelope of money that's available for the global health agenda. Thank you.
Yes, thank you. Two parts to your question, and I think you said, you talked about taking WHO into the 20th century. Whichever one out of the three of us does that must remember that we will be building further on some very important work which has been initialized by the Secretariat. It is the current leadership, Dr. Chan and her cabinet, supported by the member states, that have turned around FENSA. It is the current administration which is complying with ERT. They are the ones who have initiated the multi-pronged reform, especially the reform of the Health Emergencies Program. It was during Dr. Chan's administration that the management structures were unified and the Global Policy Group was initiated. And she was the one who took the leadership on mainstreaming health and the Sustainable Development Goals and on lending support to high-level meetings in a short period of time. So let us not forget that they have played a very remarkable, in very difficult circumstances, and we will build further on that. But at least in terms of my vision, I'm very clear that it is that this is going to be a radical change that will focus WHO on its core mandates and operate through partnerships where WHO becomes a force multiplier. Now, in terms of financing, we all seem to agree on value for money, but value for money means a number of different things. It means a number of tactical things, such as less printing, less use of, more use of teleconferences, better contracting, and it also means a number of strategic things which are pegged into my vision, stepping back from roles where others have a comparative advantage, focusing on the core missions, better prioritization, and also in terms of financing, and we talk about the new generation of financing. As I already said, I'd be very keen on a new resource mobilization strategy where I address the two key distortions, and we've already talked about that. I would, in my vision document, I've talked about a solidarity financing framework where WHO gets better at mobilizing resources from other actors who want to contribute, but there is no instrument for them to contribute. And also, I would catalyze funding for health more broadly. For instance, if the Pandemic Emergency Financing Facility wants to create an incentive mechanism to help at a specific point during the times of emergencies, it doesn't have to be owned by the WHO. The WHO can play its norms and standards role. If CEPI and other funds are coming to address market failures, I'm not going to be competitive with them, and I'll tell them, well, how can I be a force multiplier? How can I play my norms and standards role to help you thrive so that a critical need in the sector is met? I know the red light is flashing again, but just to let you know that to me, innovative financing needs a number of different things across the value chain. And of course, there's this whole space of innovative project type financing and the world of earmark levies and the rest of it, around which there are specific competencies, which is why I have committed that I'm going to convene a task force of experts in the area of monetary finance handling, because that's not my core competence, so that they can give us best advice for a range of options which needn't be mutually exclusive.
So one thing we haven't touched upon so much, though, is the role of domestic countries in health, which of course has to be fundamental in all this. What would you all do in terms of mobilising ministers of health, but also of finance, international institutions, in order to scale up domestic support for healthcare, including universal health coverage and filling any gaps that may remain in the West? Tedros starts.
Yeah, thank you. On the domestic financing, I think it's very important, and we should take whatever external support comes as a complement. The basis should be the domestic financing. And domestic financing can increase if there is political commitment in the country. And I have seen that as Minister of Health in my country, where there was a very strong political commitment, and the funding for the health sector actually increased very significantly. So WHO should work on ensuring political commitment on specific goals like universal health coverage, or epidemic, or others, based on the priority of the country. And if there is political commitment, the money follows. It's the lack of political commitment that really not being able to mobilize the resources. So that's where we should focus. And on other issues, maybe one example I can bring is when there is political commitment, the readiness of countries to help. Before I left as foreign minister in November, there was a debate in the African Union. And the debate was, there were many countries that were not happy because African Union was really increasingly becoming donor dependent. And then the leaders decided to really stop this. And one of the targets they put was 100% regular budget to fund it, and to finance 75% of the program budget, and 25% of the peace and security budget. As you know, peace and security is global, so everybody should contribute, and it should not be an issue of the African Union only. And then with that target, a committee was set and came up with a proposal that can really satisfy and achieve that goal, the 100%, 75, 25%. The Kaberuka led, Kaberuka, the African Development Bank president. And the reason why I brought this example is not only at country level, even at African Union level, when there was political commitment, there was a way to increase the financing. And that was taken care of without a lot of pain. And we can use the same thing. And one last note, because the red is there, but you're, I think, becoming generous. So the issue is when we mobilize politically, the political issue is important. We try to pass resolutions in Geneva and New York without foundation. If we're going to mobilize real buy-in and commitment, it's mobilized at the country, at the sub-region, and at the regional political organizations level. There is a saying, by the way, Geneva is the kitchen and New York is the dining room or hotel. Let's reverse this. The kitchens are actually the countries, the sub-regional political organizations, the regional political organizations. And when it comes to Geneva, it's after mobilizing that buy-in, or when it comes to New York, it's after mobilizing that buy-in to reach the final result. It's like the icing of what you call it. Without buy-in, without foundation, it doesn't work. So even resources, it should be done that way. Even other resources like antimicrobial resistance or other issues, it has to have a foundation from the bottom. Thank you.
Well, in terms of domestic resources, firstly, you have to speak to the right person and you have to speak in the right language. How do governments tend to commit to policies such as universal health coverage? You start with their manifesto. So you start influencing their manifestos when they're formulated. You work with civil society so that put constructive pressure on them. Then, once the head of state comes into power, you have to speak to them in language that resonates with their objective. You have to explain to them that universal health coverage is actually a tool which will help them make hugely popular and will help them win the next election. To the ministers of finance, you have to explain the return on investment notion during the term of their office. You have to explain to them that investment in universal health coverage is actually a social protection tool because that is what they have responsibility for. You have to explain to a trade minister that actually the implications of not investing in universal health coverage and compliance with IDPR. And you have to speak to the World Bank and IMF, to speak to finance and trade and commerce, to back these proposals up in the cabinet. And I think unless you're going to speak to people in their own language, you are not going to you're not going to succeed. Also, in terms of resource mobility, and of course, once you've done that, once you've explained to them, once you've garnered the political commitment, you have to make the right connections with them to be able to make the right fiscal policy choices. You have to technically back that up with technical support for health, which will allow them to use that freed up fiscal space for universal health coverage, and there are a range of bits and bobs that health ministries need to do and which regional offices in the headquarters can help with. So, and then of course you need to continue to monitor and you need to continue to stand with them as part of the international community to speak to their populations shoulder to shoulder, telling them that this is the right thing to do. That is going to make them hugely popular. So that is one side of the policy equation, one side of the things that the new Director General has to do. Secondly, you must tell them that a lot of cost-effective public health measures, especially in the domain of NCDs that we are advocating, which have huge public health benefits, are very cost-effective, and some of them are actually revenue-generating in their own right. And of course, there's this, as we said previously, innovative levies and the project type of innovative financing. So I think that there are a whole range of things that you need to do to garner domestic resource mobilization for health. You cannot have blanket policy recommendations to countries. You cannot go to a head of state with a huge wish list. You have to be very specific, you have to study the country, you have to know it well, you have to make the right pitch, you have to follow it up with technical advice, and then continue to follow up. And I've done all these roles. I've influenced manifestos, I've acted as civil society, I'm an advisor to the Ministry of Finance, I know how they think, and I'm the author of the Social Protection Plan. So I think you need to approach these things very holistically.
Thank you. I want to approach it, colleagues, slightly differently. Okay? The question from Andrew was how to get better domestic support for health. I'm going to say the following. Analyse the problem before you start trying to raise the money. Here's some examples. In Burundi, unsafe roads are a major cause of disability and death among young adults, particularly men. The actions to improve road safety are not going to be done by the Ministry of Health. They're done by the transport sector and probably by the private people who use the roads as well as the government. And there are 5 steps that could, if implemented, lead to a reduction in road safety, sickness and death by more than 50%. Or obesity. I was in Kuwait recently talking to the government about the massive obesity epidemic and the apparent extraordinary epidemic of diabetes there is in that country, with nearly 20% of adults having diabetes. But where to intervene? Not in the Ministry of Health. No. Working with the Ministry of Education and working with the planners to try to make certain that there is an incentive for kids to eat less when they're young, to exercise more, and then working with the Ministry of Agriculture and Food to try to reduce the extent to which people are being induced to eat hyper-processed food, because the only way to deal with so many of these problems is by working outside the health sector and through that to get improvements in health. And if we're trying to deal with these infectious diseases outbreak like Ebola, what we learned with Ebola was that it was the communities that took control in the end and that reduced their risks, particularly in inland Liberia and in inland Guinea. And by just relatively small investments in community capacity, we can make a huge difference. So I encourage everybody, when thinking about health and thinking about investment, don't go straight to focusing on the budget of the Ministry of Health. There's lots of excitement to be found and potential to be found in other areas, and that's where WHO can do such amazing leadership.
So, I'm at the dilemma here, because there are many more questions, and I've got a quick to David's watch, and we are running out of time. So, I will make a decision to ask about the things that we have not talked about, that neither one of the candidates have mentioned yet, which is big data, role of big data. With the engagement of civil society, you know, we all familiar with the saying of getting the voices heard. Role of big data becomes essential. How will the new DG harness the role of big data into getting the civil society's voices not only heard, but accommodated into the global policy making setting? Sanya, is this your turn to be first?
Okay, so big data has a range of different applications. So if you combine big data with predictive analytics, you can predict new pandemics, you can predict new disease outbreaks, and of course that has a very specific application. I am the co-chair of the World Economic Forum's Global Future Council on the future of health and healthcare. And the conversations that you have at Davos are so different from the ones that we have on the member states table in WHO. There is a huge opportunity for that gulf to be bridged, for those innovations in academic settings and in the labs of entrepreneurs to be to be honed and for them to be institutionalized within systems as wide-ranging as those of the World Health Organization for a wider good. So that is one of the applications of big data. The other application of big data is where big data becomes interoperable within systems, and when it does that, then it opens a whole host of new opportunities for health systems efficiencies, for health systems cost saving, for transparency, for quality, for effectiveness. And so what is the role of the World Health Organization within this setting? Not just big data, but within the wider ambit of innovations. It is to know where they exist. It is to know where their potential is. Then to pick all the streams up, to exercise systems leadership, and to ensure that they are deployed appropriately within different country settings according to their needs. And then to ensure that the regulatory environments keep up with those, because the speed of innovation is outpacing the capacity of regulatory environments, particularly in the developing country, to exercise the right oversight so that these new deployments are ethical, they're sustainable, and that they help to bridge equity and achieve the quality objective rather than just work for efficiencies and revenue generation. So I think I see the role of WHO at several points. And of course, you talked about civil society. You can certainly use big data for accountability, and there are different ways to do that.
I agree with my sister Sania, and maybe I will only say very briefly on this and then use the time I have on another issue. Especially on civil society, I think it's very important to not only involve them, but to really believe that they have a big role to play. It's based on big data that we can really ensure, Sania said, accountability and so on, but above that, on advocacy, we can get a lot of support. One example, Oxfam on patent rights to coffee, helping farmers in Ethiopia when the government was not able to really move really as we wish. They were a big support. And it started based on evidence, based on compelling issues why Starbucks was wrong. So this is just one country, but globally they can play even a bigger role. Then the other is on what I was saying. I just want to not comment on what was said, which I don't agree. One thing that Boz said, for instance, on we will tell countries to do this and that. To be honest, that's what should stop. Country ownership is important. When we go to countries, let's start, whether we have done a study and checked the study to them, before that, before even presenting a study like what David said or Sania, we should ask what the problems as they perceive are, what the root causes are, and what's the solution. We should start from listening. What's missing is listening. I have worked 8 years as a health minister, and one thing I didn't like is people coming to tell me to do something, to tell me to jump. I don't say how high, I say why. And we should be very sensitive on this. We should be very sensitive. Let alone governments, you go to the local communities, farmers, they know the problem, they know the root cause, they know the solution. We have to listen, starting from those communities. That's very important. And the second is, what Sania said, if this is beneficial for next election, I will tell him this is important for you for next election. So convince him to do it. I'm a politician. I have been elected several times. I don't like being told that way. I'm saying this because that's also a very sensitive issue. I don't do something to win an election. I do something because it's right to do. If anyone comes to convince me because I will get a vote by doing this, we should not accept. We should first make sure that this is the right thing to do, and we should do it. Because I don't want to just leave this podium without this alliance and of the issues. And this is because of my own experience. And I think as DG, we have to be very, very sensitive on our approach and on selecting effective ways of communication. I'm sorry, I'm not being disrespectful, but you can comment on what I said. Thank you.
Well, were you saying something to, were you wanting to criticise something I said or what? Okay, but I didn't understand what you said, so I think it was that you didn't like the way I said that we can perhaps think about working with countries to analyse the reasons for ill health, and I talked about what I was told by the people I met in Bahrain and other countries who themselves have decided that they're going to increase investment in prevention. And now let's just spend a moment on civil society's role in global health, which is where I think we're taking this discussion. Well, you know, we have to have some rights as well. You have wanted us to link together big data and civil society. I want to tell you that I'd like to talk about civil society and I'll talk about big data. Because there is something that we've not yet discussed in this forum, which was tweeted in the questions, and which is really important, which is the role of civil society in health policy in the future. In food and agriculture, there's been a real move in Rome to establish a space in which civil society and the private sector are part of the governance mechanism. It's called the Committee on World Food Security. I've had a lot to do with it because for about 8 years I've been working on food and nutrition, and I've been watching this new governance mechanism evolve. It's got a few problems. Some of you had a lot to do with it, but I think it's right that we should explore spaces in which civil society can become more engaged in the global mechanisms that we're working in. And I think the Director General of WHO has a responsibility to work with the member states to think about whether there are options. And civil society is also talking about a framework convention on global health. That also needs to be explored. So I think all of us are sort of saying it, and I'd just like to add my voice to a greater involvement of civil society. And on big data, it's an underutilised resource. If properly anonymised, it can be incredibly helpful. Global Pulse, something that I supervise when I'm not on leave like I am now. But the Global Pulse has labs in Uganda and in Indonesia. And we've shown that you can use big data to anticipate major health and food crises really well. And I would like to support greater use of big data under the proper circumstances.
So we're really running out of time, but let me then just briefly ask the three candidates a final couple of very short questions. The first is, looking back in time, who do you each consider to have been the best DG of the WHO in the past? And the second thing is thinking about the leadership qualities, the qualities of the leadership team that you will put in place, including gender parity, but also geographical spread, skill spread, and so on. What would be the components of that leadership team, either individuals or at least qualities? David.
Just in case some of you are wondering in the audience, some of these questions are kind of new, at least to me. I mean, we did in the web forum, we were asked to comment on the leadership characteristics of Dr. Chan. There was this question that said, how's Dr. Chan as a leader and how would you differ? And it was a really tough one to answer. I asked her, how do you think we can answer this one? So, past directors general. Well, I have immense affection for the late Halfdan Mahler and the way in which he put the health of people and equity in health of people number one, and really almost single-handedly created the energy that was necessary to get the primary healthcare movement to happen. And I think we're still part of the primary healthcare movement. I mean, WHO has been there as a central feature of it. Many of you, whether you're working as professionals in the international system or academics or NGOs, have been stimulated by the primary healthcare movement. So I kind of feel an enormous affection. And when he died recently, it was a big loss. But then I moved to other directors general. I'd like to pick on the one I worked for, Grohan Brundtland. Politician and professional all in one. But the one great thing about her was that she realised she needed to surround herself with a fantastic group of professionals who I think really did advance things a long way and mingled together nicely, health and politics. And I think her achievements still very much being felt. And then I pick on Margaret Chan, who I've watched the way she's particularly brought together the different regions with headquarters and made a corporate structure that's working really well. And so I find all three of them remarkable, and I'm not prepared to choose between them. And I find others also, JWD, particularly special. So sad he died early. And then the best and most important characteristic, only one, it's listening, radical listening.
For your leadership team, David, so what would be the qualities if not the individuals?
With a team, to listen.
No, but what either people or at least the qualities, the geography, the gender, the expertise that you will be looking for in your team around you?
Okay, so you have to be able to manage, and you have to manage well. You have to be able to listen, and you have to be able to listen in a way that people who are talking can believe what you're saying. You have to be able to prioritise, and you have to be able to implement. But most importantly, you have to have, as well as technical expertise, extraordinary emotional intelligence. Modern WHO, all modern parts of the international system require people who are able to work with others, whoever they might be. And the best way to test that, according to my understanding, is their emotional intelligence.
Tedros, could you manage a single director general and a set of qualities of other individuals of your team?
Single director general, I think how David started it. Mahler, I spoke during the EB interview. I spoke about him, many of you remember. He died actually a few weeks before our executive board interview. His humility impressed me a lot and continues to impress me. Humility is very important, I think. It's related to the modern high ground I said earlier. Then with Brundtland, the SDH, sustainable, the social determinants of Earth, now, which is even more on sustainable development goals. And Margaret Chan and others, I think all of them have contributed a lot. So what we should do is, nobody can be perfect. We have to see in terms of what they have contributed and what can we build on them, what can we learn from them, and then move on, and what can we also learn from their mistakes. And no need to have like one or whatever. I think they have qualities of their own. We're different, and we have we do good on some, and we may have a problem on other issues. Then on leadership quality, I think especially the team around me, it should be a very confident team with hands-on experience. Confident, hands-on experience that can be drawn from a large pool, and to have really a team which is candid to each other. From the start, I aim to build a functional team, not a dysfunctional team. When the team fails, everything is gone. So the top leadership is very important, and I will take extra care based on merit. Of course, the gender balance and the geography are important, and this should be addressed, but it will be revolving around merit. We will have enough people, women, men, enough people from all geographic areas. So the only thing is I have to open my eyes and look. In Ethiopia, when I became the health minister, there was only one department head, and when I left, almost 50%, 40-something percent, to be accurate, 42 or 43, which was really good. And then foreign affairs, the same thing. Foreign affairs, we call it men's club. And now, there was only one director and intern. We have now a couple of them, maybe around 20% of the total management. Still very, very difficult for a ministry. For some reason, it's a men's club. But we started a new training program for diplomats, and the new entries are 40%, which is, I think, which can really help the organization in the future. So from the top, I think that kind of quality is important. Hands-on and those independent, confident, who can tell me when I'm wrong. I should not be surrounded by yes, sir. They should tell me, I should tell them. Candor is the most important thing in the survival of an organization. Then that team should really focus on shared vision, should try to build relationship based on the vision, based on the priorities. And that should go down to the staff. And the management should build the relationship between staff and management. And communication between the staff and the management is two ways. Not only the management will mobilize the staff to work on priorities, influence them to share the vision, but at the same time, management should be prepared to address the challenges that the staff are facing. People know there are many good governance problems, challenges that WHO is facing. So we need to create good working environment to mobilize the staff around the shared vision that the 7,000 people can really do an effective work with really passion and belonging to that organization. And we should make sure that starting from the leadership and the staff will love this organization because its mission and vision are very important for humanity. And starting from aligning the vision and building good working environment and improving the relationship between management and the staff is very important. Of course, with that, the accountability is important. And one final thing I would like to say is internal and external assessment is important. External, a very independent one. Both the internal and external assessments should be understand the gaps we are facing to address them and take WHO into continuous improvement. One-time reform doesn't work. Reform should be continuous and change should be constant, and we should get into continuous improvement by studying our environment regularly. Thank you.
Sanya.
So in terms of the Director General, I will let history decide. But in doing that, I think we have to be mindful of the context in which they operated and the challenges and the opportunities they had. I think that's very critical. However, that notwithstanding, I will have to assure you that if I get elected, I will be studying all of them very carefully to ascertain what kind of lessons I can learn. In terms of the senior management positions and the leadership cabinet, for lack of a better word, I can give you a theoretical answer and I can give you a practical answer. In terms of the theoretical answer, there are a list of ideal human resource attributes which you put in every terms of reference, which I will try to do as well. You want the individual that you hire very sound technically, you want them to be very effective communicators, you want them to be on top of integrity, you want them to have management skills. It doesn't actually happen that way in real life. And because I've founded institutions and I have hired people, I know that you have to use people according to their strengths. Now, in the World Health Organization, there are a number of different leadership roles that have to be played. There are times when the governing body's proceedings have to be efficiently conducted and you need somebody there who has the patience for that and who is efficient. You need other people on the management side who are good at metrics and who are good at follow-up and who know about compliance with HR policies and judiciary oversight and how to deal with auditors and how to deal with internal audit. And you have to ascertain who has that skill. There are individuals who are very good at partnership building and interpersonal skills. They may not be good technically, they may not be good managers, and you need to use them there. There are others who are good techies, and you probably would use them in places where the innovation space needs to be harnessed. There are others that are good at advocacy. There are people who have their research skills and know how to work with academics. There are people who know how best to engage with civil society. There are individuals with background from the private sector who know know how to speak to their constituency. And the practical aspect of human resource placements for me in organizations is that you ascertain where the skills are and you use individuals according to where they have a comparative advantage, which is what I've tried to do.
With that, I would like to end the debate by a tweet we received. The next DG must be a of Bernie Sanders, Barack Obama, Pope Francis,
So I'm not going to ask the candidates which of these people they identify with most, but I would like to thank them very much for discussing with us here. Of course, we've also followed on Twitter. Not everyone got their question answered. Obviously, we could sit here for another 3 hours and ask also a whole range of technical questions that have been of great interest to you. But that's not possible. We have a reception following this. The candidates will join us there, and I ask you to move up the stairs to go there. Those of you that are techies, we did manage to trend on Twitter, so that's not bad, at least in Switzerland. I haven't been able to follow all the others. And I hope you take the opportunity to look at the questions that were posed and to look at the tweets that were sent, because it gives you a good feeling for how people out there are thinking about this election. We wanted to ask the candidates what they thought of the election process as WHO has introduced it. I don't think I need to ask them because, some of them at least seem to have had great fun in also presenting their positions. And I think that's important, that this communicating with a wider audience and in future communicating with the public as a whole will be incredibly important for a new Director General. And therefore this kind of discussion and transparency will be critical. It's my pleasure now to ask John Lange to come up and say a word or two about what follows. John.
Thank you very much, Ilona, and thanks particularly to the Graduate Institute for hosting this event. On behalf of the organizers, Chatham House, the Rockefeller Foundation, the Graduate Institute, and the United Nations Foundation, where I work, we do invite all of you who are present here to a reception immediately following this. It's one floor up. And please don't crowd around the candidates now. There will be an opportunity at the reception to interact with them. So we hope that you'll be able to join us there. For those of you who watched on the webcast, we hope you found this helpful and interesting, and we are sorry you won't be able to join us at the reception. But we are very, very pleased at what we think was a very strong and impressive discussion of our subject today, political leadership of global health. Thank you all for coming.
I think somebody's
yeah, not as